hopefully he sees it and enables his audio. In the meantime, feel free, still invite your friends to join us. Still invite your friends to join us. Still invite your friends to join us. Now, 3 seconds more. 1, 2, and we are ready to go. All right. So good evening, good morning, good afternoon, based on the time you get to be watching this video. Today is yet another weekend, and it's the weekend health talk where we get to have interaction with medical specialists, experts in the field, to help us on topical medical issues, all right? People who know what they know, people who are in position of authority to give us counsel, medical counsel for that matter, so as to reduce the level of misinformation on social media, especially, all right? It's best to hear from the horse's own mouth. And today, we are pleased and blessed to have a very wonderful gentleman. He is a senior colleague of mine in Korle Bu Teaching Hospital. He's a physician specialist. He's a member of Ghana College of Physicians, a member of West African College of Physicians. He is a senior resident in cardiology in cardiothoracic unit in Korle Bu Teaching Hospital. He holds a postgraduate diploma in preventative cardiovascular medicine. So this gentleman, this particular doctor I'm coming to introduce to you, is all about heart diseases and all related to the heart, all right? If you can hear me loud and clear, please put in the chat box, hearts. We're going to talk about heart diseases and stroke, because stroke is one of the commonest complications of heart diseases. So he's here to share with us as an expert. Please join me. Welcome, Dr. Eugene Ampofo. Senior, over to you, sir.
Thank you very much, Senior. Don't mind my boss, he's just overhyping me. You all welcome to this presentation. It's a very good initiative that my colleague has initiated. I'll go ahead and share my screen now. Please, is my screen visible to everyone?
Yes, please.
Okay, so my boss asked me to discuss heart disease and stroke with us today. And it's a very broad area. Heart diseases cannot be exhausted within this period. But he communicated also to me, my audience. So I'm not going to be academic here. We are going to make it practical so that we all get what we have to get, so that we can help prevent and reduce the burden of heart diseases and stroke in the country. And we also contribute our quota worldwide. As he said, my name is Eugene Ampofo. So he said heart disease and stroke. So what I'm going to do is that I use a lot of pictorial pictures so that it's easy to understand, because we are all not medics, and I don't want to go into take us to medical school. We want to understand. Now, when we say a heart disease, basically, what do we mean? What we are saying is, if you take the heart, any disease that affects the structure, okay, and function of the heart, and the big pipes. When I say pipe here, I mean the arteries, okay, that come out of the heart. Basically, is what we describe as heart disease. So any disease that can affect the structure and function of the heart, including those big arteries that are coming out from the heart, okay, form what we call heart disease. The main term, the correct term actually is what we call cardiovascular disease, okay, which basically is describing diseases that is affecting the heart, okay, its structure and function, and the vessels that carry blood across the body. So when you hear me say pipes, I mean the vessels that carry blood. I will try and differentiate them as and when necessary. So if you look at this, image, okay, you see the heart, okay, and the heart has several parts, okay. The heart mainly has 4 chambers, okay, 2 top and 2 down, okay. and the top chambers receive blood from the body. When I say blood from the body, basically the tissues or cells of the body function because they get oxygen. Okay, without oxygen, no cell can function and function effectively. So when blood is pumped to the body, the blood that is going to the body carries oxygen. Okay, and so when the body, or this, when I say body, I mean like the cells, the tissues have used up the oxygen, that blood has to go back to the heart. And when it is going back to the heart, it goes to the right side of the heart. So the heart is divided into left and right. So the blood that has been used, when I say use, mean that when the oxygen, hold on. So sorry. So when the blood gets to the body and is used, the blood goes back to the right side of the heart. Now, when it gets to the right side of the heart, which this, just imagine a line here. I will show you in my next slide. Okay. So this is what I'm talking about. This is the right side of the heart. Okay. Consider this as the midline. Okay. Now, the blood that is coming to this right side of the heart contains no oxygen, okay? Because, or limited amount of oxygen, let me put it that way, that's the right thing. So when it comes to the right side of the heart here, now the top chamber here receives the blood and pumps it down through this valve. A valve is basically an apparatus or a structure that allows blood flow or water or fluid to flow in a particular direction. So like Ghana Water pumping water, they have valves the same way as the heart also has valves. So it allows one directional flow. So the blood flows from this right through this valve here on the right to this chamber here on the right bottom. Then this chamber will also pump the blood through this pipe, okay, to the lungs, and the lungs will add oxygen to the blood. Then from the lungs, the blood will come to the left side of the heart, okay? And from this top left, it comes into this lower part of the heart through another valve, okay? And from this left part of the heart, this left chamber, the left ventricle, the blood is pumped to the body, okay, through this big pipe or vessel, okay, called the aorta. Then it goes to the body. So basically, that is how the heart functions. So any disease that affects the heart's ability to perform this function can be termed as a heart disease, meaning that disease can affect the heart muscle itself, because the heart has a muscle, okay? The heart itself also has a covering, an outer covering, and there's also an inner covering. So any disease that affects the heart muscle, the outer covering, the inner covering, the valve itself, or these arteries, these pipes, constitutes heart disease. So basically that is it. Okay. Now, like I said, the term that most people will hear of, usually when they are talking about heart disease, will be cardiovascular disease. So cardio standing for the heart, vascular standing for the vessels, the pipes that carry blood away from the heart, mainly the arteries. Okay. Now, there are several components of cardiovascular disease, but the main components are what we call coronary artery disease. Basically, this is when the arteries that carry blood to the heart itself get blocked. Okay, so the heart pumps blood to the body, but the heart itself is also an organ, and the heart also needs blood for itself to function. So the heart also has pipes that carry blood to it. So literally the heart feeds itself, because if the heart also is not being fed, the heart cannot work. And you have also what we call peripheral arterial disease, which is when the arteries that carry blood away from the heart okay, mainly to the body, the cells. Mainly when we talk about peripheral arterial disease, usually we are talking about the arteries or the pipes that send blood to what? The legs, the lower limbs, when they also get blocked. And we also have stroke. So when the arteries that carry blood to the brain or your spinal cord or the back of the eye, what we call retina, also gets blocked, or the pipe itself, the arteries burst. So basically, these are the components. Usually when we say cardiovascular disease, there are other components, but I want to insist and stress on these components. Now, what will cause cardiovascular disease or heart disease? Now, the causes can be divided broadly into the ones that you can do something about, meaning you can put in some measures to prevent it. And there are other ones, there's nothing you can do about it. So before we go into that, I want us to understand what leads to this decreased blood flow to the heart or to the legs or to the brain, okay? One common process that underlines all this cardiovascular disease is what you will hear people talk about called atherosclerosis. Forget about the big name. Basically, if you see this one, this is when you take the pipe, the artery, the pipes that carry blood, okay? This is how the normal one is supposed to look like. So consider a pipe that you've cut the pipe into two, or you've cut it through it. The surface you see, this is it. So this is the opening, the tube, okay, in the pipe. And it also has layers. I will not go into the layers, but you can see that if you look into the normal one, the inner lining is smooth, okay? It's smooth. And when we say atherosclerosis, basically what is happening is that there's a process that is activated that will lead to narrowing of the lumen, okay, of the normal artery. So it starts with a risk factor, okay, that will cause injury. So we'll talk about the risk factors. That will cause an injury or predispose you to injury where the inner lining of the artery gets damaged. And that will lead to a series of processes that activates systems within the body, leading to accumulation of fats. So you see in this view, there's accumulation of fat, but it is tiny. And this process will continue so far as that risk is not being taken care of. And it keeps accumulating until you see that yellowish thing. It's literally fat that is what reducing the internal diameter of the artery, leaving this small opening. So when there is any other or there's any further injury that leads to what? Clot formation, then the clot will block the lumen. And now when it blocks it, literally means that no blood is going through that artery. So the part of the body that artery is supposed to carry blood to will suffer. And we'll get to know the consequences. So if this is happening in the artery in the brain, then you have what? A stroke. If it's happening in the artery that carry blood to the heart, then you have what we call a heart attack. If it happens to the arteries that carry blood to the legs, then you have what we call peripheral arterial disease. Okay, so what predisposes individuals to getting atherosclerosis? Those that you can do something about: hypertension, diabetes, smoking, high cholesterol, obesity. Obesity is basically when you are big in size, when you are not active. Okay, these are the things, some of the things that predispose you in getting cardiovascular that you can do something about. They can be modified. And I highlighted hypertension and diabetes in red because in worldwide and in Ghana, these are the two main major modifiable risk factors. Hypertension alone is the single independent risk factor for cardiovascular disease worldwide, and Ghana is no exception. And cardiovascular disease is the leading cause of death currently worldwide, and Ghana is no exception. So hypertension and diabetes are significant, and you can do something about these two. What are some of the risk factors that you can't do anything about? Age. You can change your age on paper and reduce it for job, but your body or your tissue and your organs will remain your true age. So you can't change it. Gender. Being a male has higher risk of having cardiovascular disease than being a female. However, when women become menopausal, their risk is similar to that of men. You can change your gender in this modern dispensation, but genetically, if you are a male, you are a male. If you are a female, you are a female. Now, when you have a family history, you are born to a family where they have predisposition to cardiovascular disease, where, for example, your first degree relations are getting strokes or heart attacks if they are men before the age of 55, or if they are women before the age of 60. There's nothing you can do about that. That is your family. That is the family you are born into. So you have that risk. You have no control. When you have genetic or hereditable risk factors, so there are some genetic conditions that predispose you to having very high cholesterol. And it's of no fault of yours. It's not because you are lazy, you don't exercise. It's because you carry that genetic abnormality that predisposes you to have high cholesterol. Or you carry that predisposition that makes you hypertensive. You understand? So that one, you can't do much about it. Or your race or ancestry. Africans, Asians are at high risk of cardiovascular disease. So these are some of the risk factors that predispose you in getting cardiovascular disease. Okay? Now, how will someone with cardiovascular disease present? Okay? So we'll take them one after the other. Now, if you look at this, you see the man clenching the chest. So now we are going to talk about coronary artery disease. Forget about the big name, but coronary literally represents the blood, the artery that carry blood. The coronary artery is the artery that carry blood to the heart. Okay. Now, when the artery is blocked, there will be decreased blood flow to the heart. Okay. Now, pain is something that alerts you to know that there is a problem. If you don't have pain, you can't tell there is a problem. So when the blood flow to the heart is reduced, because there's decreased oxygen to the heart, there are processes that lead to accumulation of some chemicals that cause you to feel pain, to alert you that there is a problem. So typically, pain coming from decreased blood flow to the heart typically is central, okay, behind the chest, the breastbone. You see how he's clenching the chest. Okay, typically that is the location of the pain. But that pain can move to the shoulder, the left shoulder, the left jaw or left neck, or the left arm. Now, this pain can be usually, if the narrowing is gradual over a period, what is happening is that it's about demand and supply. So let's say the narrowing is about 80%. You notice that when you walk, or the person will come and tell you that when I exert myself, now when I walk 200 meters, I get chest pain or chest tightness. Okay, and when I rest, the pain goes away. That is the typical description of chest pain coming from the heart, from blocked arteries. It is on exertion. So it tells you I climb a hill, I get chest pain, chest tightening, that I have to rest for some few minutes, then it goes away. When I exert myself again, the chest pain comes. That is the typical presentation. Okay. But when the narrowing occurs suddenly, the pain will not necessarily be on exertion. You can get it at rest. That is when something happens and the artery blocks all of a sudden. That one, the pain will come with suddenly, acute. So chest pain from the heart typically is on exertion, when you walk or when you climb staircase or when you climb a hill. And that chest pain on exertion, you hear people say they have what? Angina. So when you hear angina pectoris, is chest pain on exertion, that is relieved by rest. That's the typical description of chest pain as a result of decreased blood flow to the heart. However, not everybody will present with this typical form of chest pain, especially in women or people who have diabetes or elderly patients. They do not come necessarily this typical central chest pain on exertion. They may come with an atypical chest pain, but it's up to the doctor to assess the patient's risk factors and then prune down the possible cause. Now, we talked about the next one, blocked artery. When you have narrowing of the arteries or blocked arteries that supply blood to the legs, which we call peripheral arterial disease. So typically, if you have narrowing of the blood, the arteries that send blood to the legs, the patient will present with what we call claudication. Okay, so basically, when they walk a particular distance, they get pain in the calf. That when they rest, the pain goes away. This can be similar to muscle pull. Okay, muscle pull basically occurs because your muscles are tired and they are accumulating a particular chemical called lactic acid that is causing the cramps. But this one also, there's narrowing. So when you are walking, you are unable to give adequate blood supply to the calf muscles. And so your body warns you that, please hold on, you don't have enough blood supply to cover that distance that you are covering. So it causes pain in the calf. Now, when this is advanced, then you start having changes in the skin color of the area of the leg that the blood is reduced or cut off. So initially, the area, your foot may be red and painful, but with time, you notice that it becomes mottled and darkened, okay? And when the blood supply keeps reducing, you can actually develop dark toes, which is literally a sign that the tissue is dying or is dead, like you can see in the picture. Okay, so this means that the blood supply to this area is gone. This tissue is dead, it's dark. Okay, and you see the ulcers, because what is happening is that when the blood supply to the feet is reduced or cut off, you don't feel pain anymore. The tissues die when it's completely cut off. So you can be stepping on a needle without even knowing that you've stepped on a needle. You get a wound and the wound does not heal, because for wound to heal, the wound also needs blood supply to supply it with the oxygen and the nutrients. So this is how peripheral arterial disease can also present. Then we come to stroke. So stroke occurs. So stroke is sudden. That is one thing we need to note. Stroke is sudden. So when we use the word stroke, we are talking about a sudden cut off of blood to parts of the brain or the spinal cord or the back of the eye. Most people know stroke as cut off of blood supply to the brain, but also we use the term stroke when there's sudden onset cut off of blood also to the spinal cord or the back of the eye, which we call retina. Now, if you see in this image, there's a block. You see the clots. So there's a block. So this area of the brain is not going to get blood. Okay, so when this occurs, the area of the brain that the blood supply has cut off, you lose that function. Every part of the brain has a function. There's an area for speech, an area for you to move your hands, an area for you to be able to feel pain. So depending on the area of the brain that is involved, then that manifestation will be lost. So for example, someone can have stroke and is able to talk. Someone can have stroke and will not be able to talk. So it's not that everybody with stroke cannot talk. No, it depends on the area of the brain or the spinal cord that the blood flow has been cut off. So this one, there's a clot that has blocked the blood flow. So this one is what we call infarctive stroke. There's a block. The pipe does not burst, okay? It is a clot that blocks it. So you already have the atherosclerosis and the clot comes to complete it, okay? But this one, if you see, the artery has ruptured. So there's leakage of blood. So both of them will inadvertently lead to decreased blood flow to a particular area of the brain. And depending on what that area of the brain does, you have a deficit in that area. How will stroke present? Like I said, it is sudden. Okay, so you can remember stroke in terms of using the acronym FAST. Okay, FAST. So this is not exhaustive, but it's an easier way. Okay, so people with stroke can come with what? Their face deviated. Okay, so you see one part of the face deviated. That could be a presentation of stroke. It does not mean every patient with facial deviation has stroke. Remember, I said stroke has a sudden onset. Okay, and also arm. So when you notice the person may have weakness in the arms, okay, either the left arm or the right arm or the legs. So this is to help you remember does not mean stroke affects only the arm. There may be a change in the speech. Okay, the patient's speech may be absent or become slurred. Okay, like someone who is drunk. Okay, you may you talk to the person will make signs. He's understanding you, but he cannot talk. Then the T there is time. The time is important because one, stroke is sudden, and at the same time, time is brain, as we say it. Just as if someone gets a heart attack or coronary artery disease presented as a heart attack, we say time is muscle. Time is brain because when you get stroke and you delay, if there's a delay in reporting to the hospital, that deficit, that function that you've lost may be difficult to recover. So time is very important. And when we say time, it's a big challenge in our country now, because by the time a patient gets referred to a place where they can open the pipe that is blocked, the artery that is blocked, to give the person opportunity to full recovery, that time has exceeded. Ideally, when someone gets a stroke, that person is supposed to report to a hospital as soon as possible so that within 3 hours, that pipe that has blocked can be opened up, especially if it is the infarctive stroke, the one with the clots. So in our country, 3 hours, so usually the time is 3 to 4.5 hours, but in some circumstances, it can be increased further. But how many people report with stroke to a facility that can have that intervention done within 3 hours or 4.5? Most patients, by the time they come, they've exceeded that window period, that something could have been done to open the artery that has been blocked up. So time is critical. So when you have a suspicion of stroke, please do not stay home, because every minute counts. Every minute counts. Same as if you suspect a heart attack or a blocked artery in the leg, the same thing, because if you delay, the tissue will die and it will be irreversible. To recruit that part of the brain or spinal cord or heart that has been damaged. So time is very important. Now, we've spoken about this disease. How can it be prevented? Remember that we spoke about the risk factors. So in preventing it, you need to make sure those conditions that predispose you to the strokes and hypertension and cardiovascular disease are dealt with. For example, you are hypertensive, but you are not getting your hypertension managed. You are not going for your reviews. You are not going for your clinics. Your chances of getting stroke or heart disease is very high, because what happens is that the high blood pressure causes damage to the lining of the pipes, the arteries, and propagates the atherosclerosis process that we've described. If you have diabetes, which is high blood sugar, and you are not managing it effectively, that one also causes damage to the lining of the arteries and predisposes you to atherosclerosis. If you have a kidney disease, that one also, so all these things predispose you to atherosclerosis, obesity, high cholesterol. So what can we do? These are the things that we can do. If you have hypertension and you're not hypertensive because you caused it, we don't want to label it, but there are things you can do to improve your blood pressure management. One, cutting down on salts. If most of us remember this advert, where Duraplast goes, water flows. So where salt goes, when I say salt, I mean sodium. Where it goes, water flows. Okay, so if your salt intake is high, there's a lot of water retention in your body. And the more blood volume you have, the likely your blood pressure will be high. So you need to cut down on salt intake. It's very important. Diet plays a major role in hypertension and diabetes. You need to cut down on the fatty foods, the saturated fats. You have to cut down on it. And if you have to take fat, it has to be healthy fats, the polyunsaturated fats, the vegetable sources of fats, olive oil, sunflower oil, those kind of oils. Okay, you need to cut down on the carbohydrates and increase the amount of what? The proteins, the vegetables, the whole grains, the legumes. Those are the things you need to be focusing on. You need to maintain a healthy weight. Yes, we admit there are people who have problems with weight, and it's no fault of theirs. Some people are predisposed to be on the higher side of weight, but you still have to make that effort to reduce the weight. Get a healthy weight. Okay? You should be active. Inactivity is a no-no. You are recommended to have 30 minutes of moderate intensity activity 5 times a week. So it comes to a minimum of 150 minutes. And when I say moderate intensity activity, what things qualify for moderate intensity activity? Brisk walking. So you don't need to run necessarily. You don't have to be a gym rat. If you can't go to the gym, walk 30 minutes, brisk walking. Walk, play some good music and go for a walk. 30 minutes, 5 times a week. That is 150 minutes. The more you do, the better. But 150 minutes, moderate intense. If it's intense physical activity, running, then you can have it. That is 75 minutes a week. That significantly can reduce the risk of hypertension and diabetes. And for those who are hypertensive and diabetic, improves their control. Swimming is physical activity. Skipping is physical activity. Any physical activity is better than no physical activity. Smoking. Smoking contains chemicals that predispose you to atherosclerosis, as we described earlier. Smoking is addictive and difficult to stop. So if you are having a challenge in stopping, get help. Because at the end, it is going to predispose you in getting cardiovascular disease. Limit alcohol use. Okay, when it comes to the issue of alcohol, there's always the question, how much is enough? How much is minimal? How much is moderate? How much is excessive? But the health workers we are careful in usually giving prescription, because you see, when you give a patient the go ahead that this amount is acceptable and you're not cautious, they may overdo it. So when we say limit it as much as possible. But it used to be 14 units a week. Okay, 1 tot is like 1 unit. So there's a way of converting it. You need to know the amount of alcohol within it. Now, the teaching is actually being propagated. What the evidence is suggesting that now no alcohol is actually even preferred. But there's still a bit of, I don't want to say controversy, a bit of slight conflicting data with the use of moderate alcohol intake. There is some evidence that have suggested that moderate alcohol intake is not harmful, but definitely excessive alcohol intake is a no-no. Okay? Then there are some risk factors that are new, or not the traditional risk factors, but especially in this current economy we are all struggling with. Low socioeconomic status is a cardiovascular risk. Stress is a cardiovascular risk. Psychological conditions, anxiety, depression can all predispose you to cardiovascular disease. So In as much as that you may think the economy is hurting, it's also going to have a long-term consequence if it's not well managed, because it is known that low socioeconomic status increases the risk of cardiovascular disease. Okay, air pollution also predisposes us to cardiovascular disease. Lack of awareness. If you don't know that you are hypertensive, if you don't know that you are diabetic, if you don't know you have to exercise, that one is also a risk factor because you don't know. And if you don't know, you will not do what you are expected to do. And there are some things that predispose you. For example, if you had a low birth weight or you were born preterm, your risk of cardiovascular disease is high. But you can't do much about that. So what I've described so far, we need to focus on the ones that we can do something about. Now, how do we manage cardiovascular disease? This presentation cannot exhaust management. We are not here to manage. But first of all, important is to identify the risk factors that are present in every patient who comes with cardiovascular disease. Because you need to identify those risk factors, and the ones that you can modify, as we have stated earlier, you modify them. Prevention is better than cure. So lifestyle modification, as you have described, is better. Now, the specific treatment, that one is beyond the scope. When I say specific, if someone has blocked arteries, what do we do? If someone has an acute stroke and is brought to the hospital, what do we do as health workers? If someone has blocked arteries, what do we do? That one is beyond the scope of this presentation. But when questions come up and when necessary, we'll discuss what we do when people come with blocked arteries to the heart, to the brain, or to the legs. On this note, I want to say thank you, and we can start the discussion and questions. Thank you.
Thank you very much, Dr. Eugene. That was a detailed presentation on heart diseases, what causes it, how it comes about, and very important, talking about stroke. We appreciate you so much for the time and the knowledge shared. Please feel free, ask any questions, put in the chat box or in the comment section. Dr. Eugene will gladly answer, but I will kick off with some few questions. Dr. Eugene, please, are you ready?
Yes, I'm ready.
Okay, so it's a very popular thing that we get to hear most of the times or read about in the media of certain prominent people, chiefs, big people dying suddenly in hotel rooms. From the medical point of view, not forensic, from the medical point of view, what could be the reasons?
Thank you very much, Dr. Cedric. So now, like I said, we are not going to talk about speculations because we don't know the details, but medically, if you have blocked arteries to the heart, what we described earlier on, coronary artery disease, okay? Any activity that increases the heart rate, okay, increases demand for oxygen, okay? So demand and supply is not only in economics, it's everywhere. So if you are telling the heart to run, you are telling the heart to jog, you need to be ready to provide the heart that amount of oxygen to do that work, because the heart also needs the blood and needs the oxygen. So when you have blocked arteries to your heart and you are engaged in sexual activity is an intense physical activity, okay, your heart rate is going to increase. Now, if the narrowing or the block you have is severe, okay, there will be increased demand on the heart, and there will be increased demand for you to meet that supply. But because you have blocked arteries, you'll be unable to meet that demand. So if you don't stop the activity or hold on and you continue, then you complete the block, and then that area of the heart does not get blood supply, then you get what we call a heart attack. And that can lead to what we call cardiac arrest. And if nobody intervenes early, you will die. Secondly, what happens? it may be that the individual, that's the man with these blocked arteries, is using sexual enhancing medications or drugs. Now, some of this enhancing medication put a lot of demand on the heart. So maybe he doesn't even know he has blocked arteries. And you are putting that extra demand on the heart. Then a block that is supposed to supply a particular amount of blood to the heart will be exceeded. And when you exceed that threshold, you can get a heart attack. Secondly, some of these people are on medications for treatment of hypertension, that's high blood pressure, and heart diseases. Some of these medications are not supposed to be combined with aphrodisiacs. So I don't want to be specific with names, but for example, if the patient is on a drug that causes the arteries to open up, like what we call nitrates, the person may be on nitroglycerin or isosobide dinitrate, and that person adds Viagra to it, sildenafil or tadalafil. It's a no-no. So he does not know that, or he mostly we tell them that do not combine this together with that. But when it comes to the flesh, sometimes it's difficult. And when you combine it, that is one of the consequences that can happen. So that may be the reason why some of these elderly patients, most of them who have hypertension, they have diabetes, and likely have cardiovascular disease, likely coronary artery disease, blocked arteries, but are indulging in physical activity that exceeds the limits by which their hearts can handle. So that may be one of the reasons that is contributing to these events.
Thank you very much. So yes, we've all heard from the experts about what could be from the medical point. There could be a lot of other reasons, but from the medical points, we've heard from the experts. Please, if you have any questions, put it in the chat box or in the comment section. I'll read it out. Dr. Eugene will be glad to hear us. Whilst we're waiting for that, I have another question for Dr. Eugene. Please, a lot of patients will ask you, Doc, I've been diagnosed with hypertension. I've been on medication for 5 years, 10 years. Is hypertension, diabetes curable, Dr. Eugene?
Thank you. Thank you very much for this question. Now, when we say hypertension, high blood pressure in the literal sense, there are, at least in simple terms, there are two forms of it. It's like going to primary school and secondary school, okay? We have primary hypertension and we have secondary hypertension. With a primary hypertension, there is no cause. We don't know why you are hypertensive. You are hypertensive because your father or mother or a first-degree relation is hypertensive and you carry that risk, so you're hypertensive. Then we have secondary hypertension, where you are hypertensive because of another disease. So for example, you are hypertensive because you have, I know we've all seen goiter, someone with an enlarged neck, goiter, and some call it compo, okay? You are hypertensive because you have a kidney problem. You are hypertensive because the arteries that carry blood to the kidneys are smaller and narrower. So there can be a disease that can lead to the hypertension. So when that disease is identified early and treated, your hypertension goes away. So that hypertension is treatable, is curable in the sense that there was something causing it. You identified that thing and treated it and cured that thing, so the hypertension goes away. But for primary hypertension, or what we call essential hypertension, there is no cure. It is managed. And management does not necessarily mean you will take anti-BP drugs, because it depends on the stage or grade of the hypertension you have and whether you have complications or not. When we say management, most people think about drugs, medications. Lifestyle, exercising is a form of management. Limiting your salt is a form of management. Healthy living is a form of management. So when we say we are managing hypertension, it doesn't mean everybody will be on medications. It depends on the severity of your hypertension and whether you're having complications or not. Now, the problem is when you are being managed, when the BP improves, we cut down on the medications if necessary. Now, most patients are concerned, even though it's not been asked, that, oh, the medications cause erectile dysfunction. Your doctor is there to help you. Your nurse is there to help. The health worker is here to help you. So when you take a medication, you're having side effects, come to us, communicate to us. If there are alternatives, we'll change it for you. Do some of the medications predispose to erectile dysfunction? Yes. But does everybody get it? No. Is it common? It's not as people make it look. You understand? I always give this scenario. So you want to be able to, we are adults, we are having this, so we're blunt. You want to be able to have sex for, is it 30 minutes, 1 hour, 2 hours? I don't even know the definition of what people want now. Compared to, so maybe you are doing 5 minutes, 10 minutes, you are not happy. It's a genuine concern. But your BP is also a problem. It's not being well managed. You are not taking your drugs because you want to perform. I give this analogy. Compared to having a heart attack or a stroke and not being able to do it at all, compared to doing it and doing your 10, 15 minutes or 20 minutes, which one would you prefer? Doctors, we are truthful. It's always a risk and benefit. You need to strike a balance. Anybody who tells you absolute terms that this treatment has no side effects, please run away from the person. There may be a side effect, but not everybody gets it. The percentage, the occurrence is not high or not, it's low. So talk to your doctor and your doctor will communicate to you. So that's what I will say on that.
Thank you very much, Doctor. There's a few questions on YouTube and Zoom. Let me just read some of them out for you. First of all, from Erica Nanaya de Graaf. She's asking again, just for you to reiterate, what are some of the symptoms of blocked arteries?
Thank you very much. So simple terms, when there's decreased blood flow to any part of the body, that part of the body will feel pain. Pain, it's a sign of injury. It's a sign of threat. However, not every organ feels pain. The organs that are within, I'm trying to simplify, the ones you don't see inside, like your intestines, the heart, the lungs, they don't feel pain as your skin. You know, when you take a knife or a blade and you cut your skin, you feel the pain where you are cutting, because that area, that place is somatic. It feels the pain there and there. Organs or hollow viscera do not feel pain, they feel stretch. However, it's been designed such that when there is an injury, they refer the pain to a part of the body which you feel. So when there's decreased blood supply to the heart, okay, the pain is referred to your chest. Usually it's behind your breastbone, okay, and it's usually on exertion. You walk, you climb the staircase and you get chest pain. You stop and it goes away, okay? And the pain can sometimes go to your left jaw or your left neck or your left arm, okay? That is when the arteries of the heart are blocked. When the arteries of the legs are blocked, is the same thing. When you walk, instead of getting chest pain, this one you get the pain in the calf. And when you rest, the pain goes away. And when it gets advanced, then now the skin itself starts undergoing changes. The skin becomes darkened, the tissue dies, and at the end, you may end up with amputation. The same thing for stroke. When the blood supply to that part of the brain is cut off, the function of that part of the brain is what you lose. So if the part of the brain that the blood has cut off controls speech, you lose the ability to talk. If the part of the brain that is controlling you moving your left side is cut off, then you lose the ability to move that left part of the brain, that left part of the body. So what manifests depends on the part of the brain that is involved. So someone can have a stroke and is able to talk. Another person gets stroke and is unable to talk, because in most people, the part of the brain that controls speech is the left side of the brain. In a small percentage, is the right side of the brain that controls speech. So if you get a stroke that is affecting the left part, you are likely going to lose your speech compared to a stroke affecting the right side of the brain. Also, the brain, the right part of the brain controls the left part of the body. And the left part of the brain controls the right part of the body. So when you have a stroke on your left, the weakness will be on the right part of your body. And when you have a stroke on the right, the weakness will be on the left side. This is it in simplicity, but it can be complex.
All right. Another question is, how do you differentiate between hemorrhagic and ischemic stroke if you're in the district somewhere where you don't have access to CT scan?
Thank you very much. Like I said, time is of essence, and therefore it is important to know the type of stroke the person has had. Okay, in that sense, when we say hemorrhagic, it means the pipe or the artery is burst and the blood is leaking. And when we say infarct, it means the pipe is blocked, as we showed earlier on. The truth is that without CT, you cannot absolutely distinguish it. When we say CT scan, it's like a brain imaging. Without it, you cannot absolutely stick your neck out. There used to be this teaching that those who come with a bleed type of stroke usually are bad. They are sicker or they are ill. You can see them, you know that, but it's not an absolute science, because someone can come with blocked arteries, and if the area of the brain involved is big, the person can also be that bad. So the truth of the matter is it's difficult to distinguish. What you need is the CT scan. That is why it is imperative that every region in this country has a functioning CT scan. For example, just 2 days ago, I got a call from a classmate of mine. The dad had stroke in an area in the eastern region, and he has to come to Accra. This was around 9 p.m. to get a head CT scan. Already, he lost time going to that hospital. Remember, we spoke about the 3 hours, preferably. So by the time he got to Accra, he already exceeded the window period. And it was the kind of stroke that we could have reopened by breaking the clots. Okay, but unfortunately, he exceeded the window period. So these are the things that we need to be pushing as a nation, that there is health equity and redistribution of resources across the country. Okay, thank you.
All right, so somebody is asking, can intake of pepper be a contributing factor for any of the cardiovascular diseases you mentioned?
Thank you very much. But we are currently in a world that we say we are in what we call evidence-based medicine. Evidence-based medicine is, there should be data to support what you say. Now, you don't just say, I said this. You can be the expert, agreed, but what is the evidence? That is where we are now. Currently, to the best of my knowledge, there's no evidence that taking pepper will give you cardiovascular disease.
All right, thank you. How often should one go for medical checkup on the heart?
Thank you. So this is a very good question. So when you say medical checkup on the heart, it can be as simple as just checking your BP and your pulse. Usually when we talk about checkup, most people are worried about big things. You see, it depends on one, your age and your risk factors. It's not the same quote fits everybody. So if you're a young person, you don't have hypertension, you don't have diabetes, you don't have any risk factor, checking your BP alone is enough. So some will even say, if you check your BP and it's normal and you are young, they can even say 5 years. So it depends on your risk. So when you see your doctor will assess you, and based on your risk, there are a lot of calculators and tools we use to calculate someone's risk of having a cardiovascular disease. And based on that risk, we can advise. So it's not fixed for everybody. But if you are young, just having your blood pressure and your pulse check alone is enough, and your heart being examined is enough. Based on what we see, we may say do something we call an ECG, which is to look at the electrical activity of the heart, and a chest X-ray, and based on that, we'll advise further, but it's not fixed for everybody.
All right. Another question from the same guy, from a gentleman on YouTube, Fred Tech. Thank you very much for joining us. Please, is it wrong to over-exercise your body? From the same gentleman.
Thank you. We all say too much of everything is what? Is bad. So the answer is in your term, over-exercise.
Yes.
We don't want any, you see, there are limits for everything. You see, you won't have probably a direct link and say over-exercise is going to cause a heart attack, provided you don't have what? A risk factor. But let's say you have blocked arteries. There's a particular prescription of exercise that you're supposed to do. If you exceed it, it becomes like what is Dr. Sedonian said, happening in the hotel room. Okay, so do not exceed your supply. Make sure your demand and your supply match. Moreover, what do you benefit from over-exercising? Even so, the principle in exercising and building muscles is not even only in the exercise. You actually build the muscle when you are resting or sleeping. So exercising or lifting the metals or wherever breaks down the muscles, then they regenerate and expand when you are sleeping. So those who gym Monday to Sunday with no rest, you realize they've gone for gym for 10 years, lifting all sorts of metals, but they are still not developing adequate muscles. Compared to those gymming 3 times or 4 times a week and resting 3 days. Rest is important. In as much as that we are advising exercise, rest is important. That's why we said 30 minutes, 5 times, 2 days to rest. Even God rested.
I like that. I like the end. Even God rested. Great. Now, another question is, we always hear people say mild stroke. Mild stroke. What kind of stroke is that?
Thank you. You know, it's a layman's term. You understand? Like heart attack. Like so what we've been talking about, coronary artery disease, can present as heart attack, but the heart attack is a vague thing, same as mild stroke. As a medic, we have scales which we use to rate stroke. So yes, some strokes can be considered mild, but in the layman's term, the layman's definition for mild may be different from what a specialist is thinking of, because we use objective scales, not subjective scales. So there are things we look at that has been studied, and we give each of them a score, and based on the score that we have, we can say this stroke is severe, mild, or moderate, if you want to put it at that. So yes, if someone gets a stroke and the person comes in unconscious and remains unconscious, compared to someone who had a stroke and has some weakness in just the left side, it's easy for us to say that that one is mild compared to the one that is unconscious. But they are objective scales that we use to define the severity of stroke.
All right, another question. Please put in your questions. Dr. Eugene will be answering all of them for us. We have a few more minutes to go. Now, someone is asking, can someone with low blood pressure suffer a stroke?
Yes, why not? Remember, hypertension is the leading cause of cardiovascular disease, stroke, heart attack. It doesn't mean it's the only cause. So if you have low blood pressure, but you have diabetes and you are not managing it well, you have a risk factor. If you have a low blood pressure and you are smoking, you have a risk factor. If you have a low blood pressure and your cholesterol is very high, you have a risk factor. So we don't just look at just one risk factor. But if in isolation, you don't have other risk factors, low blood pressure, the question is, what are you calling low blood pressure? Is it low normal blood pressures you are talking about? I don't know your definition for low blood pressure, because you see, when your blood pressure goes very low than usual, that one can also decrease blood supply to the brain. You understand? But just having a low normal blood pressure in general, like there are people who have low normal blood pressures in general, and you don't have any other risk factors, and you are doing the preventive measures, should not. But remember, like we said, risk factors are risk factors. It doesn't mean that if you don't have that risk factor, you cannot develop a stroke. It's not absolute. We should always remember that. Thank you.
All right. Thank you very much, Dr. Eugene. Thank you. If anybody has any more questions on YouTube or Zoom, please kindly feel free to ask. This is a free consultation. You have the expert here. You see the way he's talking with facts and figures. That is because that is what he does on daily basis. You should see him in Korle Bu, Charlie. The guy is a big boss, you know. Thank you very much, Dr. Eugene, for the time. Anybody has any more questions to ask? Let me see. Yes, then final question. It's a layperson's question. Let me just put it across. In the villages, you hear someone saying, don't get me angry. When you get me angry, my BP will come. Dr. Eugene, what do you have to say about that?
It's actually true. When you're angry, your BP go up. So it's actually true. And like we said, we didn't want to make this very academic, but I'll try and explain. So there are variables that contribute to the blood pressure you record. Okay. One of the variables is dependent on your blood volume. Okay. That's why we said where Duraplast goes, water flows. So if you take in too much salt, your blood volume goes up, your blood pressure can go up. The other parameter is your heart rate. Okay. So when your heart rate is higher than usual, it also increases your blood pressure from the other variable that contributes to your blood pressure. So when you're angry, what happens? When it comes to the body, there are two systems. There's one we call sympathetic nervous system, and there's one we call parasympathetic. So the sympathetic is the one that fear and panic or fear and flight that makes you run. That system that when it's activated, your heart beats fast, you panic, you understand? That system puts you in overdrive, literally. So when you're angry, you activate that system. And when you activate that system, you tell your body to release some chemicals. And the job of those chemicals is to cause your heart to beat faster. And in so doing also, to cause the arteries and the pipes to become smaller or narrower in diameter. And in so doing, the pressures in the pipes go up, because remember, if you have a big pipe and a smaller pipe, which one will have higher pressure? The one with the smaller pipe diameter. So when those chemicals go up, it causes your pipes, the arteries, to become what? Narrower, and at the same time increase your heart rate and your BP will go up. But that high blood pressure will not be sustained, because it's in the moment that you are angry. If you calm down and you're not hypertensive, that blood pressure should normalize.
Yes. Thank you very much. Now, one last question. The person is asking, what are the risks of suffering from a silent stroke?
All right, thank you. So usually when you say silent stroke, I presume a stroke might have occurred, but the person did not manifest it. Usually when people use that term, that's what they say. So he goes to do, for some reason, he goes to do a head CT scan. And they notice that, oh, he has actually had some strokes in the past. And he himself does not even recall that he has had a stroke. So what happens is that there are millions of vessels around, and millions. The brain, as you see, it has a lot of components, but there's always a buffer, okay? Even with the blood supply, it is very few areas that have just one vessel going there. There's always another vessel that serves as a collateral, so that because God knows that if one fails, the other can help. So there's always a collateral. So sometimes you have a part of the brain blood supply being cut off, but the collaterals come in to help. So the person does not develop obvious clinical symptoms and reports into the hospital. Okay, and also sometimes the area of the brain that is involved has other parts compensating, such that the person does not, you don't see the clinical. But if a stroke is demonstrated on head CT scan, is as important, whether silent or not silent. And preventive measures has to be put in not to have another stroke. The first one might have been silent, but the next one that comes may be your last one.
Maybe loud. All right. Now, Felix Yeboah, aka Pinocchio, is asking, what is silent myocardial infarction? That's number one. Number two, he wants to know the difference between MI and PE. PE is pulmonary embolism. He wants to know the difference. And what
All
is
right, Pinocchio. So Pinocchio was my classmate in SS.
Oh, okay.
Yeah. So yeah, I shared it on my page, and yeah. So Pinocchio, hey Papa, what's up? All right. So so if he said silent MI and pulmonary embolism.
Yes.
Now, like I said, when we say silent MI, basically it means that the person has had the event but did not present. So for example, MI, for those who don't know, stands for myocardial infarction, which is called heart attack in the layman's term. Now, so there are people who get the heart attack, but they don't have chest pain. So they don't even know that they had a heart attack. You understand? There are several reasons for that, but one major reason for that is when they have diabetes. So what diabetes does is that diabetes damages the nerves that help you to feel pain. So you've had a heart attack, but instead of feeling the pain, because diabetes has damaged the nerves, you don't feel the pain. So that person might come with what? Another symptom that is known to be associated with heart attack. For example, when people have heart attack, they may vomit, they may feel nauseous, some may even collapse, some may sweat profusely. So the person comes to the hospital with sudden onset sweating profusely, vomiting, and everything, but there's no chest pain. But if the doctor knows that this person is diabetic, he does an ECG, which is like looking at the electrical activity of the heart, and there's obvious evidence that the person is having a heart attack. Then we go a step further to confirm it. So usually when the term silent is used, it means that the person does not come with the obvious chest pain that most people you expect to have when they're having a heart attack. Now, when we say PE, the PE is not physical education like we all did in school. What it means is pulmonary embolism, okay? Pulmonary stands for lungs. Embolism is when a clot formed at another place moves from where it is to another place. So when a clot moves, that clot is called an embolus. Okay, so pulmonary embolism is when you have a clot that has formed somewhere else, mostly in the legs, moving to the lungs to cause problem. So mostly they come with sudden onset difficulty in breathing. They mostly do not come with chest pain. They come with difficulty in breathing. However, they can come with chest pain. But if someone with pulmonary embolism comes with chest pain, usually that PE is significant, it's a bigger one. But mostly they come with difficulty in breathing. The chest pain sometimes can be as a result of the dead lung tissue that has occurred because of the blocked arteries to the lungs. And it causes irritation of parts of the lung, the covering of the lung, and they can come with pain when they breathe in. So they tell you when they breathe in, they have severe chest pain, what we call pleuritic chest pain. But if you remember, the chest pain we describe for blocked arteries is not when you breathe in, it's usually on exertion and relieved by rest or sudden onset. That's what I would say on that.
Thank you very much. And time is far gone. For those who are not aware, those who join us late, Mrs. Ime Obot and the few others who join us late, the recording will be shared on the YouTube channel. I've just shared it in the chat box on Zoom. Please feel free to subscribe and be on standby. I will share the recording very shortly. Dr. Eugene Ampofo-Befi, thank you very much. We appreciate your time. If there are no last minute questions, let me be sure, check YouTube. Okay, someone has a question on YouTube. Please, soft drinks and caffeine containing drinks, do they have some negative influence as far as cardiovascular diseases are concerned?
All right, thank you. So as we say, soft drinks are very rich in what? Sugar. They have high glycemic index. When we say glycemic index, it's basically the amount of sugar in a particular quantity of food or something you are taking in. And these ones, they are not that, what they are going to do is that it's unhealthy food. The soft drinks, it's unhealthy. So when you continue taking, basically the body does not waste energy. So if you give it too much glucose, which is mostly in this soft drinks or food throws at the end, it will be converted and stored. The body will not waste that extra sugar. It will store it because the body is thinking of future when you are hungry or starving. Okay, so it will usually store the excess. Initially, it will store it in the liver, and the excess, it will store it as fat. And usually when it's storing it as fat, it stores it around your abdomen area, and that's where you get a pot belly. You understand? Now, when that continues and is persistent, that pot belly kind of fat deposition predisposes you in developing type 2 diabetes, because it predisposes you in having what? Insulin resistance. And we all know what diabetes can do. So that is mainly the connection. Caffeine has its benefits and disadvantages. But in terms of respect to cardiovascular disease or hypertension, if you are taking caffeine persistently, basically it's a stimulant. Okay, and what does stimulants do? They keep you on the edge. Okay, when they keep you on the edge, what happens? If you're not sleeping, your blood pressure will go up. Remember stress. Okay, heart rate going up. So that's also one way, but caffeine also has its benefits, but we won't discuss in this area. But yes, it can, in the long term, excessive use can have detrimental effects.
All right, thank you very much. Again, those who join us late, the recording will be shared on the YouTube link. We have other recordings that have been done in the past weeks as well there on the YouTube channel. Feel free, subscribe, invite your friends to also join and also listen to the recording. And of course, on Saturdays, every Saturday, 4:30 p.m. GMT Ghanaian time and 5:30 Nigerian time, we are here with different specialists and even same specialists, but different topics to give you accurate information from the expert. So please, in the absence of any further questions, thank you very much, especially to Fred, Felix, Madam Margaret, and the few people who asked questions. Of course, Erica and Anaya DeGraff as well. Please join me, everybody, to say a big thank you to Dr. Eugene Ampofo-Befi for making time. You guys have no idea how difficult it is to get people like him, to spare 1 hour plus on a call like this. We appreciate you so much, Dr. Eugene. If there are any final words you want to share with us, we'll be glad to take it.
Thank you very much, Dr. Cedric. It's been a privilege and an honor to do this presentation. Cardiovascular disease is a war. that we all have to fight. I won't say it's unfortunate, but most people think it's malaria and infection that is killing us. That is 20, 30 years ago. We are dying of cardiovascular diseases. And if you care to know, it's very sad. We have young patients, 40s, in their late 30s, coming with what? Heart attacks, with strokes. Now the strokes are not killing the older folks. They're killing young guys, 40s especially, late 30s. So don't think you are young, so you are at liberty, you can live your life as you please. Please, let's be cautious. We mentioned about the preventive measures. It's difficult, but in as much as possible, let's make the conscious effort to do so. If you've never checked your blood pressure, please, tomorrow morning, go and check your blood pressure at the nearby pharmacy. Get to know your blood pressure. If you've never checked your sugar, go and check your sugar. Okay? If you smoke, make the effort to stop. If you can't, get help. Alcohol is good. Today is Saturday. I will not say it's good, but people have their definition for good. But as much as possible, be responsible. Okay? And let's watch our diets. Have a wonderful weekend. Thank you.
Thank you so much. So the focus is on prevention, because prevention, as Dr. Eugene rightly said, is better than cure. And the essence of these health talks is to let you know what we can do to prevent it. And also those who have issues, how they can restore themselves back to good health. But prevention is the best way to go. We've had an extensive talk on heart diseases and stroke. Thank you very much, Dr. Eugene. Again, the recording will be made available. If you have any special requests, any special issues, you want to reach me for any help, my contact is on the screen. Feel free to reach out on WhatsApp. And if you have if there's any form of assistance that I can offer, I will do so. We just want to help as many people get the right information across, and the best way we can also help, we will help. Thank you very much, Dr. Eugene, and every one of you who has made time to join this session today. We appreciate you all. Thank you very much. Once again, it's been a pleasing pleasure serving you all. Enjoy your evenings wherever you are.